Well, hello, and welcome to my case study for growth and development of the infant, a well baby check. So this case study will incorporate all of what you're learning for the first three modules. So if you're watching this before you have done the readings for modules 2 and 3, have no fear, it will make sense as you go through. So this 4-month-old baby is a well baby, meaning the baby has no prior medical problems, just coming into the clinic for a regular baby checkup. So what are the things that the nurse is going to look for in that well baby checkup? There's so many things. So it's hard to remember all of them. Um, so let's go through. So first of all, when the baby comes in, you're going to do the baby's vital signs. And this baby has a heart rate of 110, a respiratory rate of 26. What do you think about that? Does that seem high, low, normal? Well, in your book, it does give the normal vital signs for age groups, and this is normal. That's one thing that new pediatric nurses sometimes will be startled at, thinking, oh my gosh, the heart rate is so high, the respiratory rate is so high. But remember, babies have faster heart rates and faster respiratory rates. So this is completely normal. The next thing, the baby's weight, or excuse me, length is 26 inches and the weight is 32.2 pounds. Now remember, keep pens up point. We always convert to kilograms for babies' weights. So kind of just divide that by 2 and you'll get the average. So divided by 2.2 and you get 6 kilograms. Baby's head circumference is 40 centimeters. What else do we need to know about this baby? Well, we need to know their past medical history. So where was this baby 4 months ago? In utero. So the maternal history becomes the baby's history. So we want to ask the mother, did she need to use any medications? Was she diagnosed with any infections? Did she need to take any antibiotics? Was she smoking? Did she do any drugs? So everything is in this baby's chart that they were not exposed to any toxins. The baby was full term. The baby weighed 6 pounds, 8 ounces at birth, and their immunizations are up to date, UTD, and the baby did receive their 2-month vaccines. The baby is solely breastfed, no solids yet. And we're going to ask about development. What is the baby doing? Because when the baby comes into the clinic, the baby may not perform. The baby may not do all the tasks that they know how to do because you're only seeing them for one little snapshot in time. So you're going to ask the parent or caregivers. And throughout pediatrics, we will be using these terms interchangeably because not all of the family caregivers are parents. You can have legal guardians, you can have foster parents. So we use parents or caregivers as the guardian term. So we're going to ask them, what is the baby doing at home? What are you noticing? We want to make sure that the baby is developing in an expected pattern. Remember, all babies, if they have expected development, will achieve these milestones in a certain order. They will first begin to roll, then they will sit, then they will crawl, then they will walk, and so forth. But they may do it at different times. Not all babies do them exactly at the same time. So we're going to ask the parent. So the parent tells us the baby's rolling over, the baby lifts, as we can see from the picture, the baby is lifting their head and chest off the floor when they're prone. They're socially smiling. They don't have any primitive reflexes left from when they were born, because these do disappear at around this age. But the Babinski reflex is intact. And language, what is the baby doing? The baby is cooing, laughing, which is great. So over here on the right, those are the things we're always going to ask for in the well baby visits. And well baby visits are usually scheduled at newborn, a few weeks old, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 24 months, and then every year after that. So when we are measuring babies, we use a growth chart. So we don't have to guess. We look and see on this chart exactly what percentile the baby is at. So the baby is 26 inches. The baby is 4 months old. So you look up here and it says, I know it's hard to see. That's why I gave you the downloadable documents. But if you look at the top, it has birth, 3 months, 6 months, 9 months, and so forth. So you find the 4 month line, which is this dark red line right here, and you follow it all the way down. The length, the top portion is the length. Then you find 26 inches here, 26 inches, and then you follow it across to the 4 month line, and that baby is tall. That baby is at the 95th percentile for their height. That means that they're taller than 95% of the other babies their age. And then the weight, the same thing. The baby is 13.2 pounds or 6 kilograms. Again, you find that 4 month line and follow it up to 6 kilograms. The baby is right here at the 50th percentile. So you follow that along and you see it says 50th right there. So the baby is average weight. The baby also has doubled their birth weight, which is what we expect by about 4 to 6 months. Next is their development. Are the babies developing in the manner that we would expect? And there's lots of different resources that you can use as a pediatric nurse to determine what are those developmental milestones that the baby should be reaching at certain ages. But the main developmental tool that we use, especially to screen for developmental delays, is called the Denver Developmental Test. And again, I have this document downloadable for you because it's difficult to read. But basically, it has up on the top, again, just like the growth chart, it has months. So it'll follow 2 months, 4 months, up here, 2 months, 4 months, 6 months, 9 months. The same thing that you follow that 4 month line and you follow it down. And in the blue is 95% of babies should be doing those skills that fall to the right of that line. So if we draw a line down here, the baby should be doing all the tasks on this side because those should have been achieved at, say, 2 months, 3 months, and so forth. You're going to look down and see, and there's different categories on the left. It's social development, fine motor skills, language skills, and gross motor skills. So we know that the baby is socially regarding their own hand. They look and they can recognize their own hand. Fine motor, they're following 180 degrees. If you have a toy, the baby will follow. They can grasp a rattle. The baby is squealing, laughing, making vowel sounds like ooh, ah, turns to a voice. So if the mother or father is saying something, the baby will turn to the voice. Gross motor, the baby is rolling over. And when you pull that baby up off of a supine position, holding their hands and pull them, there's no head lag. That's a really important pens up point. If a baby does have a head lag, they would need to get referred by 4 months old because that is not meeting the milestone and that would be a red flag. Okay, so next is immunizations. We heard that the baby's immunizations were up to date. So that means that in the chart, it's documented that the baby had received hepatitis B at birth, the 1 month hepatitis B that could be given anytime between 1 month and 2 months, and all the 2 month vaccines. The baby is now in at 4 months and would require all of these vaccines. So that's what we'll do before the baby goes home, is they'll get those vaccines. So there are immunization schedules that are distributed every year with updates from the CDC, and the American Academy of Pediatrics puts out this parent immunization schedule that's easy for parents to understand. But you can get familiar with also reading the CDC's version of the professional. For your exam, know how to interpret this immunization schedule. You do not have to memorize the schedule, but you should be familiar with how you determine if a baby should be getting vaccines at what age. So now we know that this baby will be getting a rotavirus, a DTaP, which is diphtheria, tetanus, pertussis, Haemophilus influenza B, pneumococcal, and polio. So what are our clinical findings for this baby? It's a well baby. There's no concerns. The anterior fontanelle is open, which is that little soft spot on the top of the head right here. This anterior fontanelle is soft. We can feel it. It's not depressed or sunken. It's not bulging, which is normal. And then the posterior fontanelle, which is in the back of the head, is closed at this point, which is normal. The red reflex is positive in both eyes. That's where you shine the light in the baby's eyes and you can see the red reflex. That's normal. We expect that. We look for that. If it's not there, that is a concern. The baby is able to follow 180 degrees. We know that their heart rate is regular and rhythm. The baby has no murmurs. When we get into the cardiovascular section, you will hear about different congenital defects that may show up in infancy. So we do want to always be looking for that. The baby's reacting to sounds, so we're checking their hearing, which is great. There's no head lag. We're checking their neurologic development, and the baby's rolling. The baby has doubled their birth weight, and they should be doubling their birth weight by about 4 to 6 months. The infant will triple its birth weight by 12 months usually. When the baby does receive their immunizations, the baby cries appropriately. The parents then calm the baby, pick the baby up after getting the immunizations, and providing that trusting relationship with the baby. This is Erickson's trust versus mistrust. The baby stops crying. The baby knows that its needs are being met by the parent. So we're not only assessing the baby during the well baby visit, we're also assessing the relationship between the parents. Are they bonding? And is that baby able to be moving through those stages? So to continue on our clinical findings, we know that the birth weight is good. The height's at the 90th percentile, which is good. Not that we want all of our babies to be at the tallest percentile, but it is normal. What we are looking for in the growth chart is not just that they're at a certain percentile. It's not that the 90th is good and the 5th percentile is bad. What we're looking to see over time is that baby staying on that curve, or is the baby perhaps falling off the curve, starting at the 90th percentile and then they come back in and they are drifting off. That would be a sign of something going on, like a failure to thrive. So the baby is on a good curve. They've received their immunizations. We know that flu vaccine can be given at 6 months old. So we will tell the parents in the anticipatory guidance time when we're working with them all the things that we want them to anticipate. And there's a lot. So I've only highlighted a few, but number one is safety. We know that infants are normally healthy people, and this is a well baby, of course, with no chronic illnesses or acute illnesses. So if anything is going to harm this baby's health, it will probably be a safety issue. So make sure that you're reminding the parents to keep the baby in the back seat, in the car seat, facing the back. Make sure you're telling the parents, this baby's rolling now already, so do not leave that baby up on anything. Don't put them on a bed to sleep because they're going to roll right off of that. The baby's next developmental milestone, they'll start sitting with support with their hands, tripod sitting. So we want to encourage parents to hold the babies in that position. Starting solids will be the next thing on the agenda for nutrition. Babies will have what's a primitive reflex called a tongue thrust, where they will kind of spit anything out that comes into their mouth. It's a protective reflex, which is great, prevents them from choking. But we need to make sure that when it disappears at about 4 to 6 months, you can start solids. Usually we start with a rice cereal. Avoid anything other than that to begin with. It's choking hazards. Definitely no hard foods. And our next visit will be at 6 months unless there's concerns. Ask the parent if there's any questions. Send them on their way. Thanks. Bye-bye.